Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a February 16th, 2022 update from the Dubuque County Public Health Incident Management Team. I finally feel comfortable in reporting declining COVID-19 cases. For about the second or third week in a row, Dubuque County and a lot of other parts of Iowa and the country are reporting decreasing positivity rates, deaths, hospitalizations, and cases. However, pretty much everywhere in the U.S. continues at high community transmission for COVID-19. And in Dubuque County over the last 7 days, 211 cases were reported. That's a decline from last week's total. Omicron continues dominating as the variant with the highest number of cases, with 100% of Dubuque County positive cases in February. Now keep in mind, we've experienced several peaks and valleys over the past 2 years, which means we have to continue to be mindful that COVID-19 is circulating and has the ability to infect us, and also will continue to develop variants. The labs continue to be very busy analyzing tests, and access to testing has greatly improved in the community as clinics and retail stores are now able to get more testing supplies and kits. Because of the continued high transmission, it's still very important to get tested for COVID-19 if you have cold, flu, or any of the general COVID symptoms such as loss of taste and smell, fatigue and body aches, headache, respiratory symptoms, among others. Knowing your COVID status can help you do the right things to keep others from getting infected. And just because you may have had a negative COVID test a few weeks ago, doesn't mean you don't need testing if you've been exposed or developed symptoms since then. If your symptoms are worsening or persistent, even after a negative rapid home test kit, get tested again through your doctor or an acute care site. We know the rapid tests are not quite as reliable, especially since you're swabbing yourself. One final reason to get tested: if you have medical conditions that put you at higher risk of developing severe illness from COVID-19, you can receive antiviral or antibody treatments, which could decrease the severity and/or length of your illness. Well, I quit making COVID-19 predictions a long time ago, and because we keep discovering new information based on all our data and experiences, most public health officials are also leery of making predictions. One thing most agreed upon is that COVID is here to stay. However, if we are entering into the home stretch, or the beginning of the end of the pandemic phase at least, let's continue to be safe and not put others or ourselves at risk of getting infected with COVID-19. The Super Bowl is over, Valentine's Day has passed. The biggest thing to look forward to is spring, or more weeks of skiing if you're a skier. Myself and the Dubuque County Public Health Management Team will continue keeping you up to date with new and changing COVID information and guidance, as well as continuing to work with our local healthcare partners, schools, businesses, and policymakers. So hang in there, stay safe with a healthy lifestyle and COVID mitigation strategies to keep the curve going down. Thanks for tuning in, everyone.